Thank you, everyone, for all of your responses in the chat and on the poll. It looks like we have a good mix of people, from students to families from all over. So thank you for joining us today. Well, we're going to go ahead and get started. Welcome to the College Orientation Summer Webinar Series. My name is Stephanie Martel, and I'm a graduate intern within the college program in orientation, and I'm assisting with college orientation this summer. And today I'll be serving as a moderator for this webinar. So today is all about the student wellness services and opportunities available to you as a UChicago student. So we will have the first 30 minutes or so will be dedicated to a presentation about student wellness, and the remaining time will be left open for questions and answers that you all will have the opportunity to ask our guests today. So because you are in a webinar, we will be accepting questions through our Q&A portal, which you can find at the bottom of your screens. You will see that you're able to upvote questions, and we will give time for everyone to look through these questions and cast their votes before taking as many of the top questions as time allows. So first, as we transition in, is everyone ever able to hear me? Okay, great. Just want to make sure. I'm going to pass it over to our first guest, Amy Sari-Tainhill, the Senior Director of Operations in UChicago Student Wellness. Whenever you're ready, take it away.
Great. Thank you so much, Stephanie, and welcome everybody. So again, my name is Amy Sari-Tainhill. I'm the Senior Director of Operations here at Student Wellness at UChicago. And my colleague here, Julie, if you want to just introduce yourself before we get started.
Sure. Hello, everyone. My name is Julie Edwards, and I'm the Director of Health Promotion.
All right, so we are lucky enough, you see here on this slide, we are in a brand new wellness center. So what that means is in March of 2020, prior to the shutdown for COVID, we were able to move into this beautiful new center, which is located at 840 East 59th Street. And it now combines all of our colleagues in one area. So student health, student counseling, and health promotion and wellness. So we have a beautiful new space for, not only to receive these programs and other programs that we have, but just as an area, as you can see here, just to study, just to hang out. Hopefully for some come fall quarter, we'll be able to do this. It's a beautiful new space, tons of natural light, very spacious. There's plants. We tried to keep the integrity. The space was built out in a courtyard. So we tried to keep the integrity of some aspects, historical aspects of the space. So it's very beautiful. We can't wait to see everybody. So we're very lucky in that aspect. That's the front lobby in the left-hand picture. And in the right-hand picture is actually the health space with the nurses station there in the center, and then the exam rooms around the perimeter. So to talk a little bit about what student health specifically for medical services, we offer primary and acute healthcare and routine medical services, gynecological services, STI testing, lab. We have our own dedicated lab for laboratory testing. We offer immunizations. Currently we have 2 nurse navigators that assist in navigating care. We have an eating concern support and assessment, and we do a lot more than that too. So there's our website there. It's our wellness website, and then the / for medical services for more information. Oh, go ahead, Julie.
Sorry,
It's okay.
I realized I was muted. My apologies. I'll just explain a little bit about our mental health services. And so I just want to first stress that we really try to provide the highest quality of accessible care around mental health services and making sure that they're culturally sensitive as well. So within our Student Wellness Center, we now, as Amy had mentioned, we have all of our mental health clinicians, and we encourage you to come if you would like to seek care in any way. We offer short-term individual and couples counseling, as well as psychiatric services. And so if you are already seeing a therapist, what you can do is schedule an appointment with Student Wellness, and you can see some of our physicians so that you can maintain that continuity of care. And the great thing about our psychiatrists are that they can provide medication management for students as long as you are a student here at U Chicago. And so I really like to stress that as well. It's something really important, wanting to make sure, again, that you are able to continue the care that you need. There is therapy, as I mentioned, with the individual and couples counseling, but we also provide a variety of support groups. And those support groups are typically around various topic areas so that students can come together with others who are experiencing various challenges or potential concerns. But then we also offer support spaces for a variety of populations around campus, from international students, as well as individuals who identify in LGBTQ+ communities, and also with students of color. And so I definitely encourage you to take a look at our website to find what is available and the times and days that these are offered. And then something also that we provide is called Let's Talk. And this is informal, confidential, and anonymous drop-in consultations with counselors. So students can sign up. Right now, they are done virtually, so it would be a Zoom call. But when we are back on campus, we do hope to also offer some in person. And you would be able to just drop in if you would like to, and you could speak with a counselor and talk about various things you might be experiencing. And then they can help determine next steps and make some, give you some advice and some guidance in general. We also provide a lot of referral services within our mental health area. And so as far as referrals, they could be to other campus resources, as well as to outside therapy, depending on the needs of students. We're trying our best within all of our areas within student wellness to meet the needs of you as students as you're coming into the university and as you are here. We want to make sure we're supporting you in the best way possible. And one thing to keep in mind as well, we mentioned it here, but it's also in medical services. We provide 24/7 access. So if students are experiencing physical or mental health concerns, you are able to call our number, 773-834-WELL. And if you call that number, you would be connected with either a mental health clinician or a primary care clinician, whatever the need is. But it's a great way to provide services because we know that not everything happens during normal work hours. And so we want to make sure that we are providing the best care to support you as students. And here is the website for mental health resources specifically.
If I could just interject, thanks. So I just wanted to add a couple things before you went into health promotion, Julie. Some of the other things that we're working on to ensure that the student has the best experience possible here in student wellness is our check-in process. So if you all during this pandemic has taught anything, we're trying to use technology the best we can. We're going to have a touchless check-in option where you would just scan on your cell phone if you have one available and with you to check in for your appointment. And then you would be able to, if you needed to complete any questionnaires or forms, you could do so right on your personal telephone. If you did not have your personal telephone or do not wish to use it, you can always walk up to our front desk to one of our coordinators to check in. We'll have an iPad available that's been sanitized for you to use. Or, again, if you don't have your cell phone or do not have one available to you, we also have pagers that will be able to alert you of, the service of when they're ready to see you. Again, with the pandemic and just the ongoing needs of students, we will also have a mixture in all areas of in-person and tele appointments, just meaning that, it'll be depending on what you are coming in for, you may have the option to do it virtually, or if you do need to be seen in person, we would want you to do that to assess you the best we can. Another thing that we've been working really hard on that we've heard loud and clear from former students is online scheduling. So we have that ability now in counseling, as well as health and medical, to be able to schedule your appointment online. Again, depending on what it's for, you will be able to do that. Otherwise, you will have to call, as Julie mentioned, our phone number to speak to someone so that we can assist you the best we can. So just wanted to also make those points. As Julie was talking, it reminded me of those. So thanks, Julie.
Thank you, Amy. And now I'd like to cover some of our health promotion services that are offered also under student wellness. So what we try to do with health promotion is provide various resources, programs, and services that will meet the needs of students and hopefully reduce stress and anxiety and really help support you in a variety of ways. So first of all, we offer 4 different mindfulness meditation courses every quarter. And so these are 4-week sessions where students will meet with us during an hour each week, where they learn basic breathing techniques as well as guided imagery and just different ways in which you can take care of yourself while you're here in general. We provide also something called mental health first aid. And this training is actually an 8-hour training that is open to students, staff, and faculty, where we train individuals on how to identify potential signs and symptoms of someone experiencing a mental health concern. How do you have a conversation with someone you're concerned about and then refer them to the appropriate resources? Now, another program that we offer is called wellness coaching. And this is something that we started about 2 years ago that's really been popular with students, where students can meet with one of our health educators one-on-one to have a conversation around well-being in general and what's working well in their lives and where there might be opportunities to improve. And through that conversation, they create a wellness vision for themselves, as well as goals to achieve that vision. And so if it's something that you're interested in, especially as an incoming student, I strongly encourage you to take a look at that, because it might be able to help you set some goals for yourself for the upcoming academic year. There are also alcohol and other drugs educational programs. These are interdisciplinary with our medical, mental health, and health promotion staff. We really come together to provide a variety of services around this area. And then we have a sleep program. It's called Refresh, where students can sign up. It's about 7 weeks. You'll receive 1 email from us once a week with just tips and tools on how to make your environment more conducive to sleep and why sleep is important, and just some strategies around that. And that's definitely something I would encourage you to take a look at, especially as incoming students. There are a variety of ways to get involved with student wellness. We have peer health advocates, and they are around different topics where these advocates go and actually educate peers on sexual health, on mental health, as well as body image and body positivity. We also have peer health liaisons, and these are primarily graduate students who serve as liaisons between student wellness and their respective divisions and schools. And then we also have WellSARs. WellSARs are elected within the houses, and they really serve as a liaison between college students in housing and student wellness. So they will bring in different speakers, and they will have access to stress kits that we have, where it's a lot of fun activities that you can bring into the houses. But it's just, again, a way in which we can support you from a broader standpoint. And then there's our other initiatives that we offer, and we highlight Take 10 here. We encourage students to take breaks. And so for every hour of work that you're doing, whether it's academics, working on a project in a lab, or doing a PSET, really taking 10 minutes per hour to just give your mind a break so that you can come back recharged and refreshed and ready to continue. So I just wanted to highlight a few of the health promotion activities that we also offer within student wellness. And lastly, we just want to cover briefly a bit of information about our student health insurance plan. And so for those, you have probably already received communications about this, but the University of Chicago requires that all registered students carry adequate health insurance. Now that can be our student health insurance plan, or it can be if you're already on your parents' plan. But in keeping with the requirement that the university has, all students are enrolled in the Uship plan. So Uship standing for University Student Health Insurance Plan. I like to stress this point because you have to actively make a choice of whether to waive or enroll in that plan. And so when you go into the portal, you have to waive if you already have coverage. If you do not waive, you would incur a premium cost that you most likely do not want to incur. And that's why I want to make sure I stress that to all of you, that you'll receive communications about that. Please do not forget about that message. Don't forget to go into the portal when it's available, because you will be able to have access. And if you already have insurance and if you're already covered on a parent's plan, you want to make sure that you waive that coverage for Uship so that you are not charged when you shouldn't be. There's a lot of information on our student insurance website. So again, it's wellness.uchicago.edu, where you will find information on all of the services that Amy and I have mentioned. But I just wanted to bring this up because this is a timely thing that will need to take place. And so I just encourage you to take action as soon as you are able to. And so I will stop there. I, again, want to just share our website so you all have access to that. But now I'll stop sharing our screen, as I know that we will be opening it up for questions. And I believe there are some in the chat as well as some Q&A. So I'll turn it back over to Stephanie.
Great. Thank you so much, Amy and Julie. This was great. I'm sure everybody here learned so much. We're going to go ahead and jump into some Q&A. I'll be asking you all the questions. Thank you for everyone who have been submitting some questions. And again, if you would like to submit some questions, please make sure to click the Q&A submission box, and you can submit it through there as opposed to in the chat. So I will be reading off the Q&A. So the first question we have is, could you walk through what the process is when a student is not feeling well and would like to get help from the center?
Sure. So I can take that one. I'm assuming not feeling well is they would want medical services. So we would ask that students call our number. So it's the 773-834-WELL, or they could go into the portal to see if there's any availability for that day. I think if it's pretty immediate and they're not feeling well, we would ask them to call. We're not taking any walk-ins at this time, but that could potentially change at any given time, but we're not doing so now. We would want the appointment to be scheduled, but we do absolutely have same day availability or next day availability, whatever the student would need if they're not feeling well. Depending on what it is, we would want them probably to call more than likely. But again, they do have that option to schedule online and be able to assess what they would need and put them with the best provider for their needs.
Thank you so much. Our next question is, when is the earliest incoming students can access therapy and/or counseling?
So Amy, this probably aligns with students being able to access medical services as well. So I'm wondering if you would be able to take this.
Sure. So I believe, as soon as, I know students are arriving at different points in time, but as soon as they are registered and we can see that they, on our end that they are registered and they do have an insurance, as Julie mentioned, whether it's the Uship or another insurance, that is verified, they can utilize our services.
Awesome, thank you. Our next question is, would you be able to walk through the process to obtain a psychiatrist and/or meds management for incoming freshmen? Is there an urgency to sign up? Perhaps is there a backlog to obtain these services in September so that there is no break in service?
So I think that's a great question. And first and foremost, what we recommend for students is to work with their current providers to refill a prescription before they come to campus, just so they can make sure that there is no lack of medication if they need it. But then I also encourage, if you know that it's something that you are going to want, whether it's therapy or medication management, to contact us as soon as you are able so that you can set up that initial appointment. Students will have an initial appointment within our counseling services. And then after that initial appointment, they'll be referred to an appropriate provider that can help them with whatever they may need.
Great, thank you. Our next question, if you remain on your family's insurance, are you able to take advantage of student wellness services without your family being aware, for example, PrEP or birth control medications?
So yes, I think that's one thing that we will make sure we put into our slides moving forward. But student wellness does not accept insurance. You do not need any type of health insurance to access our services. The reason that the health insurance is needed is if you need to fill prescriptions, or if you need a referral to a specialist or somewhere else within the Chicago area, or just other potential care that you need. We just do not want students to incur excessive costs related to any type of medical care. So that's why insurance is required. If a student is on their parent's plan, the parents do not receive any information within medical or mental health on them accessing student health services.
Great, thank you. What percentage of UChicago students utilize mental health services?
I believe at this point, we are just under a quarter of our student population who are accessing services. And that does not mean that students aren't going elsewhere either, but just under, I think it's 22.5% of students are accessing our counseling services. And that's why we definitely encourage you all, if it's something that you would like to explore or something that you're already engaged in, if you're going to therapy, we encourage you to make that appointment at your earliest convenience so that you can get connected with folks here within student wellness.
Awesome, thank you. Our next question is, are international students able to receive medication in the same way domestic students would be able to?
I'm not really clear on the question, but as far as, again, establishing, if you already have a provider right now, we would want you to kind of make sure that you are all set when you arrive to campus. And then when you start services with us, any student, regardless if they're international or not, would be able to utilize our services and get prescriptions as just like anybody else. Yes.
Thank you. One student said, I'm planning to keep my current insurance, HMO Illinois. Should I change my primary doctor to the doctor at the UChicago Wellness Center?
So I do not believe that changing doctor is necessary, because that student would be able to come to the Student Wellness Center regardless. It's not going to go to insurance. So unless Amy, if you have any other comments, but I would stay and keep your primary care physician as is, and you can still come into the wellness center to be seen for any type of physical ailments.
I agree. I think that would be the best idea, to keep your current primary care provider on that plan. And we can always communicate with that person in the event that you utilize our services, so that there's no gaps in between. So I would encourage you to keep it. But we can always tell any of the providers here that you would like information sent to them as far as just coordinating care or just keeping everyone in the loop.
Great, thank you. Our next question is, can first years get involved with peer health advocates?
Great question. So yes, we are looking at ways that we can engage first years. So I definitely recommend, I'll put my email into the chat. You can reach out to me directly. We typically do a recruitment during spring quarter of every year, so that we have the majority of our peer health advocates solidified for the upcoming year, because we do offer trainings and things like that. But if it is something you're interested in, I encourage you to reach out to me directly, and I'd be happy to get you connected with our team to do so.
Great, thank you. One question we have from a parent, I believe, is, my daughter is filling out the medical authorization to disclose / obtain information form. The form is asking the hospital / agency, what should she put down?
So the form that's being filled out, as far as, so they would want our information for that. It would be UChicago Student Wellness, if that's the question. If they need someone specific as a provider, we would probably want to wait until a provider was established. But I can also, for something that specific, I can also put in my email and try to dig a little bit more if it's more specific than that.
Okay, great. Our next question is, most insurance providers only provide coverage on a calendar basis where the school is requiring a confirmation today of health care coverage from September 2021 to August 2022. Please explain how this gap from January 2022 to August 2022 is covered by the major health insurance providers.
So the anticipation, I think that's a great question. And just one other thing to note about our insurance plan is it is effective from September 1st through August 31st. So even if you signed up in October or prior to the deadline, it would be retroactive to September 1st. So I just wanted to highlight that since I didn't when I spoke about insurance earlier. But as far as providing that you are currently covered and have insurance, I recommend that you put in the insurance information that you have. Most of the time that information continues and it's just something that you will elect. If you do change it January 1st, so if the parent's coverage changes, if there's a change of job, a change of plan in general, then you can also include that in the portal so that you can put that new information into the portal. But for the purposes of waiving, if you are currently covered, you just use your existing plan information that you have right now that may be good through December 31st.
Great, thank you so much, Julie. So next we have two student athlete related questions. The first one is, does the center treat student athlete related injuries or will they be sent to UChicago Medical Center? And the second question is, are student athletes especially encouraged to get Uship over other insurances?
Well, I think that second question, I think that again, that would just depend on the athlete's situation and their needs during the time. So, but as far as treating student athletes, we work very closely with UCM, so University of Chicago Medicine. And we actually have in-clinic dedicated time and space for Dr. Holly Benjamin, who works in ortho. So she sees student athletes as well as other students that may need her services. So the answer to that is yes, we do see the student athletes here in student wellness, as well as any other students that may need that type, to see that type of provider.
Great, thank you. Our next question is, in addition to support groups, are there group therapies for conditions like anxiety and/or eating disorders?
Yes, we do have a variety of group therapy options that are available. This past year, they were not offered virtually, but we do anticipate that we will continue offering them in autumn quarter of this year. And so what I recommend is you go to our website and you will be able to see them as it gets closer to autumn quarter. So probably mid-September, you'll see the actual topics as well as the days and times that those groups will meet. And then you can sign up that way through the website. But I definitely encourage you to take a look. And again, if you have any questions, Amy and I put our emails into the chat, so you can always reach out to us directly and we can help you navigate any services or questions you may have.
Great, thank you. Our next question is, are filled prescriptions an additional cost often covered by students' insurance, and are they given by the pharmacy or wellness center?
So that is a good question. I think it would again depend on the insurance as far as the cost for the prescriptions, but they are definitely provided here from the provider. So they're written here and it would just be up to the student's choice. We have a pharmacy here on campus through UCM, a full pharmacy that you can utilize here through student wellness, or if you just wanted to do a CVS or a Walgreens, we can do that as well. So there's many options there, but as far as the cost, again, it would just depend on what insurance that the student is holding.
Thank you. So we have two questions about sharing health histories with parents. The first one is there a way to ensure my parents will be notified if I have a medical emergency in light of patient confidentiality? The second one is very similar. Can students authorize that their health history while at UChicago be shared with their parents?
So I think there are definitely, yes, I think the answer to those questions are yes. So depending on whatever the student wants, if they do want their health history, or if they put their parents as a emergency contact in lieu of something happening, they will definitely get notified. And then there is a sharing option, I believe, in our portal that'll allow you to share your medical history or anything going on with a parent. So yes, that is also an option for them.
Thank you. Another question asks, how does the Odyssey program help students cover the cost of health insurance?
So I'll defer to my college colleagues, but I believe that Odyssey covers the cost of the Uship premiums. But I will ask either Katie or Whitney to chime in the event that I'm misspeaking.
I don't know off the top of my head, but I know the Odyssey program is sending out a communication later this month specific about Odyssey student insurance. So that should go out by the end of July. If not, you can reach out to the College Center for Student Success that oversees the Odyssey program, and I'll drop that in the chat.
Thanks, Whitney.
Yeah, thank you, Whitney. Our next question is, do you have any information on traveler's insurance for an international student who will be arriving in Chicago before September, which would be before the insurance kicks in?
So for early arrivals, students are able to sign up for, they have an option of coverage directly with United Healthcare Student Resources. And so I'm going to put that website into the chat, but the Uship plan does cover international travel. So it's not just in the city of Chicago, it's with United Healthcare, and you are covered across the country and across the world. So I do like to stress that as well. And you may want to look into that early option so that it covers you from August 1st versus September 1st.
Thank you. So our next question is it advisable to obtain letters from current medical care providers at home in their home country to ensure continuity of treatment and or medication?
Absolutely. I think if you're proactive about it and going to do that, there's again, in our portal, in our PNC portal, which is what we'll be using for the Wellness Center come August quarter, there's ability to scan documents. So I think absolutely, if you want that cross communication between who you're seeing now and who you're going to be seeing when you arrive, I think that's absolutely a great idea, and you would scan all of that information into the portal once that becomes available to you.
Thank you, Amy. Our next question is, in the case that a parent loses their job, therefore loses medical insurance, does the student have an opportunity to enroll in Uship in the middle of the school year?
Yes, so that would be a qualifying condition. And so what you could do, and that is typically if there's a loss of coverage, if coverage changes, if there's a birth, a death in the family, a marriage, type of civil union, any of those would be a qualifying event where you would be able to add insurance coverage. So that would not be a problem. There is information on the student health insurance website, and you would just take a look at that and fill out the form, and we can get you connected, making sure our insurance carrier will be able to add that coverage for you.
Great, thank you, Julie.
Mm-hmm.
Do you all recommend Power of Health, Advanced Directive, etc., in the event of something catastrophic happening? If so, where do we direct the paperwork at the University of Chicago?
I don't know the specifics around that, but again, I think if you have any of that information, again, that is something that you would be able to scan into the portal. There may be some other areas around campus that would want it as well. I'm not sure if Julie or other colleagues on the phone would know that. But again, if you have any of that or have any advance directives or power of attorney or just, who needs to be involved in any decision making or needs to know your health history or anything like that, you would obviously, yes, we would want that as well and would be able to be scanned into your portal to view across the board so that we would know what was going on.
And to Amy's point, we have a student wellness portal. It's my wellness portal that you all will have access to. You're automatically put in there, and then it's an electronic medical record. And so just as she mentioned, those documents could be scanned in and then be part of your formal chart that we have on file that people can review if needed in the event anything would happen.
Great, thank you. What are some things that Uship does not cover?
I think that's a great question. Well, I guess one thing, it's medical insurance. So it does not cover dental or vision. And so I think sometimes there's a misconception about having insurance. But as far as everything else, the Uship plan is really a platinum plan, and it covers a wide range of resources and services that are available. So I would encourage you to take a look at the website if you're looking for something specifically about making sure it is covered, because all of that information is available on the website. And for those, I believe there were some things in the chat asking about dental and vision, and Whitney did share that, but those are optional plans. And so if you do want dental and or vision coverage, you can also sign up for those, but it is not done through the university. You would sign up with those carriers, but we do have several that are offered. And I see that Whitney just put it into the chat so that you have access to that.
Great, thank you. We do have a couple questions about study abroad, including would you comment on the availability of the students who study abroad who already are using their parents' health plan to cover the only piece which might not be covered, such as medical evacuation? And the other question, very similar, is does Uship cover students who are studying abroad for a semester?
So I will answer the last question first. Yes, Uship covers students who are studying abroad, or if they're traveling anywhere, they are covered under the plan. As far as the medical evacuation question, I'm not quite sure, and I'm happy to get that information that we could then send out in another communication to you all. But I don't know the specifics around that, particularly if you're on a parent's plan. So you may want to contact your parents' carrier directly and just ask them that question, just because there's so many different insurance plans that are out there, and some may cover and some may not.
Great, thank you. So we have one more question on here. If anybody has any more questions, please feel free to send it in the Q&A in these last couple minutes. But the question is, what is the easiest way for the students to pick up their prescriptions at the Student Wellness Center? Thinking of the winter and lots of snow, which makes going off campus a huge effort.
Sure. So again, I think I'll echo what I said before. It'll be up to the patient or the student where they get their prescription filled. It doesn't have to be filled here. We actually here in Student Wellness do not have a pharmacy, but our colleagues do. It's just, you can actually get through inside of the buildings. If you were to navigate, it is a big place, but it's possible to get to the pharmacy over on the University of Chicago Medicine side. Or, if there is somewhere closer to you, we can send that prescription there. If you're off campus or, somewhere is a little closer, and I think even nowadays too, depending on where you get, and I think it may be an option at UCM, you can even get them delivered to you. So I think there's a lot of options. I think just depending on what it is and what your preference is, I think that it's possible.
Great, thank you both so much. We have one more question that just came in with the respect to study abroad question that you all just answered. Contacting the private insurance provider, our provider covers everything but medical evacuations. How does this incremental risk get covered?
I do not have the answer to that question. And so I'm happy to reach out to our insurance colleagues to just find out more around that specific question. And then if you want to reach out to me directly, I can just connect with you offline and hopefully get an answer to that question.
Thank you so much, Julie. Just to reiterate for everyone here, for students and parents and anybody else joining, the enrollment period opens August 2nd and they have until October 16th for this plan. We do have 2 more questions that just came in, so we'll go ahead and answer those. So if one question asks, if I'm using my parents' medical plan, can I use my parents' vision/dental plan?
Yes, you can use their dental and vision. So it just depends though on what coverage it provides, making sure it's provided within the city of Chicago. So I would encourage you to take a look at that. If for some reason it doesn't cover you in Chicago, you may want to consider the optional dental and vision plans that are offered with the university or through our carriers.
Okay, great. And the last question we have that we'll take today is, what's the cost of the Uship plan per year?
My apologies as I was on mute and trying to look that up quickly. But all of the information is on our student insurance website. Let me just take a look at our premiums. I may have to send that after the fact.
I'll put it in the chat.
Okay, thank you.
This is a direct link.
Thank you, Amy.
Mhm.
Great, thank you so much, Amy. So thank you everybody for all of your questions. Thank you so much, Amy and Julie, for everything that you have taught everyone today and answering all those questions. If anybody has any more questions, please feel free to reach out through the website, take a look at their website that they talked about. This is also recorded and will be sent to you all, so you all have access to rewatch this if needed. And Whitney just sent in the chat for any other questions and sent the website as well. Thank you both so much for being here. And that is it for today. Thank you all.
Thank you.